Good morning, everyone. I think it's still morning. My name is Justin Ayers. I'm a former healthcare trial lawyer turned health tech entrepreneur and the founder and CEO of Equality MD. Lawyers are called counselors at law, but we're really counselors at life. And the one question I've received from LGBTQ Americans for over 20 years is, where can I find a doctor who makes me feel safe? This question has plagued our community for generations, and that's why I created Equality MD, not just for all those people who are trying to find inclusive healthcare, but for myself as well. This was me a few years ago at my dermatologist's office. When I came out to my doctor as gay, he said he couldn't complete the physical exam because he didn't feel comfortable touching my skin. He left the room, leaving me feeling alone and less than human. Sadly, my experience is not uncommon. 1 in 3 LGBTQ Americans experience discrimination in a clinical setting, causing 1 in 4 to avoid care altogether. 1 in 6 are denied care, as I was, and 1 in 8 live in states where providers can legally deny care. Discrimination creates data gaps that expand existing health disparities. And this lack of data creates a cycle of decreased patient engagement and worse patient outcomes. Notably, our community represents every other demographic, from racial minorities to military veterans. Our solution is an AI-powered LGBTQ healthcare and data insights platform. Our providers complete evidence-based cultural competency training. Our AI matching algorithm connects patients with providers based on each patient's unique intersectional identities. We then transform new patient journey data into actionable insights for health systems, payers, and employers. The first step of our solution is an inclusive telehealth product we recently launched with our telehealth partner. We match LGBTQ patients with culturally competent providers and collect new patient journey data. Because 80% of our community says mental health is their primary healthcare concern, we have made that a priority. Patients love the fact that they can finally be their authentic selves with their doctors, and doctors equally love the fact that they're able to treat patients they never would have been able to find on their own. For a low monthly subscription, patients can enjoy up to 36 virtual healthcare visits per year and access to over 1,000 medications. This cash pay model is ideal for those who are uninsured or underinsured. We pay our telehealth partner just $15 per patient per month, and this incredible deal enables us to generate rapid monthly recurring revenue, which in turn helps fund the AI platform. On our telehealth platform, we are delivering culturally competent and affirming care to LGBTQ patients. We're helping doctors discover and treat an invisible patient population. We're helping payers satisfy LGBTQ mandates. We're helping employers attract and retain diverse talent. Our AI platform will be able to deliver value-based care. We'll be able to help doctors create safe spaces where patients can be their authentic selves using our LGBTQ GPT. And we'll help payers utilize predictive analytics so they can anticipate the future needs of LGBTQ patients. Finally, we'll help corporations authentically engage the $1.7 trillion LGBTQ consumer market. We're an early player in the $216 billion LGBTQ healthcare market, which is growing as younger generations are increasingly coming out. We have 2 primary competitors, Folks and Flume. Both companies do fabulous work serving transgender patients, a population that only accounts for 4% of our community. I have a 12-year enduring relationship with the National LGBT Chamber of Commerce, an organization that boasts 53 chapters and over 7 million members. Each local chapter will organically promote Equality MD throughout their region, enabling us to become a trusted community anchor. We'll repeat this process again and again and again in each new market we enter as we grow nationwide organically. Our 2 beachhead markets of the Mid-Atlantic and Southern California have 8 regional chamber chapters and millions of potential customers. We've gone through 4 accelerators and 4 fellowships. We have a paid pilot program with Cedars-Sinai coming up. We've completed immense customer discovery, and we recently acquired one of our smaller competitors. Our channel partners fuel network effects and keep our customer acquisition costs low. And by going to market with a telehealth partner, we're saving time and money, building brand awareness, limiting liability, generating rapid revenue, all while solving an immediate problem. Our MVP is complete and validated, and our tech architecture from that will be the foundation of our new platform. Payers are already very excited to see our new insights, which creates some exciting exit potential. For the next couple of quarters, we'll be growing our telehealth product and then continuing to build our AI platform. In the coming years, we'll expand our telehealth product nationwide, launch our AI platform, sell some insights, and prepare for exit. We are the ideal team to meet the needs of our community because we have lived the problem we're solving. I'm a 15-year serial entrepreneur. Jason, our VP of product, was the first hire at the popular gay dating app Grindr, and our CFO has 30 years of experience and 6 exits under his belt. Collectively, we have the skill sets to build a scalable solution. In Texas, I had a bit of a light bulb moment when I realized that our team had already done an extensive design thinking-based customer discovery project where we conducted over 32,000 patient surveys and 350 in-person patient interviews. No other company has this unique data, and it validates the earned trust we have within our community. But we didn't stop there. We utilized Catapult's teachings to inform how we implemented 2 agile pivots, first of which was changing our customer challenge from data management to new customer delight to ensure they become brand ambassadors. We did extensive A/B testing on our website and overhauled it to ensure higher conversion rates. It's working. I'm grateful to my mentor, Hunter, who helped us with this presentation. I'm also grateful to my classmates who challenged my assumptions in safe spaces that Catapult created. If we're fortunate enough to be selected as the winner today, we will turn $20,000 cash prize into 316 new customers, resulting in $25,000 monthly recurring revenue, $140,000 annual recurring revenue, creating a 7x return on investment. Finally, icing on the cake, I've got a 501c3 nonprofit, and we'll be able to give Equality MD memberships to those most in need so they never lose hope. Equality MD, we're empowering LGBTQ patients to become the superheroes of their own healthcare stories. Thank you for interest in our story. Thank you, Capital One, and especially to the Catapult team. It's been an honor and a privilege.
That was awesome. I think I just turned myself off. That was an awesome presentation. Thank you. I'd love to hear a little bit more about the role you think AI can play in the business. It was very clear about and made sense to me around how AI powering provider selection could be really compelling. You had a bunch of other AI applications, though. I'm curious if you could talk a little bit more about beyond just finding providers, what else you think that's going to enable for you?
It can do a lot of things, from helping streamline medical data, creating a more personalized patient experience, improving operational efficiencies of health systems, which helps save money and increase revenue. It will help generate predictive analytics so hospitals and providers and insurers can understand how this population behaves as a patient base so they can better improve their efficiencies operationally, clinically, and economically while bringing in new patients because they've created that sense of trust.
Got it. Thank you.
Sure.
I want to gain clarity around your reference to NGLCC.
Sure.
So I want to understand do you currently have a relationship with them, or are you going to develop a relationship with them? Because I didn't see them in your timeline.
That's a good point. I have a 12-year relationship with them. I started the chapter in Richmond, Virginia. I serve on their national mentorship committee, which I accidentally created because I opened my mouth at a conference and said it's not working.
It happens every time.
It happens. It happens. I voluntold myself.
Right.
And so now I'm the only non-corporate person on a national mentorship committee, which gives us incredible access to corporations who are looking to us to help create more inclusive healthcare options for their diverse employee base to attract and retain new employees. Now, the NGLCC is very decentralized, so it doesn't manage each of these chapters. We'll go to them individually, and we've been in the process of doing that basically since 2012. I jokingly say I've been building this company my entire life without meaning to, simply by showing up, being my authentic self, and giving first. So we're tapping into the power of a community that we've been a part of for over 12 years now.
Okay. So are you also, your plan with engagement, are you giving them the marketing strategy, the solutions on how to reach out in the community?
Yes.
Or are you going to leave that up to them?
Well, it depends on the community and what their leadership says, but what we found so far in our 2 beachhead markets, so we're not trying to boil the ocean here, is that they're looking to us for guidance because they are experiencing member attrition. So they see us as a membership benefit for joining the chamber, and we'll also provide them the materials for marketing purposes, and they can insert things that's unique to their specific chambers, be they Los Angeles, Long Beach, Richmond, or Baltimore.
Okay, so last question. The market in terms of discrimination is big, granted, and you're focused on LGBTQ. Have you also given any consideration to immigrants coming to this country?
Absolutely. As I mentioned earlier, our community is truly unique because it represents every other underserved demographic. I mentioned racial minorities, military veterans, but that includes everything, neurodiverse immigrants. We're starting with what you know, like writers say, write what you know. So we're starting with a community that we already have earned trust in, and that's how we got the pilot at Cedars-Sinai. They see us as a trust bridge to a massive community in Southern California they can't reach because their messages are falling on deaf ears. They need someone like us who is part of the community to engage them.
Oh, this is awesome. You spoke about the revenue stream from the individual customers, but I didn't catch the part around the B2B revenue streams. So you're going to use the data. How are you going to do that?
Individuals, as I say, it's $79 a month,
Yep.
15 to our partner, we keep 64. It'll be $49 a month for B2B, and we're targeting the 50 to fewer employees because they aren't required by the ACA to have healthcare.
Right.
But a lot of them are trying to attract and retain talent, as we found by working with different chamber members.
Sure.
And we'll also be able to utilize that benefit to showcase some of the bigger clients that we are already in talks with, like Cigna, Wells Fargo, et cetera. No offense to Capital One, that this could be a solution by coming in through employee resource groups, helping engage the community more authentically beyond Pride, and serving the community every day of the year.
Awesome. Thank you.
Thank you so very much. Thank you.